I'm going to first explain my vision of where I think we should be in healthcare in Louisiana. And then I'm going to explain really quickly what's going on with these public-private partnerships. And then I'm going to explain what I'm proposing in legislation. Is that okay? Okay. So, in Louisiana, we've always had value on life and the dignity of the person. We've actually had a history of the charity hospital system since 1736, when we were actually a French colony. The people of Louisiana still truly want a healthcare safety net, but they also want to see that it's accountable to the community, and that it's effective, and that it's efficient. Our charity hospital system has been underfunded to dangerous levels, leaving those most in need without help. I hear more and more stories of the children with toothaches, or the children with broken arms in the classroom. At the same time, we see the mental health, the developmental disabilities, and the addiction disability services dismantled to a point where members of our community are reaching out for help in sometimes very violent ways. We have a crisis here in Louisiana, and it's a crisis that affects all of us. It affects our community, and our charity system has been at times a model for the whole world, but today has actually become a separate but unequal system, with systematic funding problems and sometimes top-heavy oversight. While the Secretary of Health and Human Services, DHH, the Governor General, pushed for a regionalization of the mental health care and the addiction services, the Human Service Districts, as they are called, was a step in the right direction, but unfortunately they're underfunded, and without proper investment in mental health care and addiction services, the hospitals will never be effective nor efficient. There has to be a seamless coordination between mental health care and physical health care to really find efficiencies in the system. Public hospitals are run with the majority of public dollars. Actually, even private hospitals depend very greatly on public funding. Taxpayers deserve to know that their public hospitals are being run effectively and efficiently. One emergent healthcare practice that we see that the federal government is actually providing for is something called an Accountable Care Organization, an ACO. But the key here is forcing a coordination between mental and physical health so that you find savings. And in that savings, those who belong to the organization get, I think, about 40%, and the federal government keeps the rest of it. So it's a way to encourage the coordination, and you're rewarded for the outcomes that you produce, rather than just being paid for service. LSU, personally, should be able to focus on training our doctors and our nurses. And with all of these cuts, is that me? With all of these cuts, you actually find them not being able to focus on training our doctors and nurses at all. Every 2 months, you have to change their mind and try to find ways of funding it. So the question is, how can you truly empower communities and coordinate all of this health services by region? And how do you also give them all the tools in the toolbox rather than keeping them underfunded?